Hello, my name is Donna Ockenden, and I am the Chair of the Independent Review of Maternity and Neonatal Services at University Hospitals Sussex NHS Foundation Trust. The aim of this video is to inform you of the processes that make up the review and what you can expect from the review team. Please feel able to stop this video at any point, re-watch the video and ask any questions directly to the review team if you are unsure about the process. The review team and I have been working together with local families and the Department of Health and Social Care, referred to as DHSC, to define the terms of reference for the review. The terms of reference provide a framework for the review that guides the review team, families and the Trust as to how the review will operate, including which cases will be included within the review, the expected outcome of the review, and what families can expect from the review. So, what should families expect from the review? The review expects to write their findings, conclusions, and actions within a published report. Families will receive a personalised family feedback document relating to the treatment they received at the Trust. This document is written by a team of clinicians who have reviewed each case based on the available evidence and have graded the treatment the family received using the KESD grading system. The terms of reference must first be approved by the Secretary of State for Health and Social Care. Once finalised, the review team will begin to actively engage with families, staff and local communities. How does the review make contact with families? This term refers to the process of the Trust looking through their records and sharing any cases with the review team that meet the terms of reference for the review. The review will then write to families to inform them of their inclusion within the review. Families have time to opt out of the review if they do not wish to be included. If you wish to find out about the pathway of the review for families, please watch the video, What is an Ockenden Review Family Pathway? How do the review team ensure that staff voices are heard? Staff will be invited to share their experience of working at the Trust, either via email, face-to-face, through the staff survey or over Zoom. Staff can share their experience as many times as they wish, as we recognise that your view may change throughout the duration of the review. When will the review team make contact with staff? The review team will visit the Trust regularly to meet with staff at the beginning and end of shifts. This is an opportunity to meet the review team and learn about the review and how staff can share their experiences. The review team recognises that the process of the review can be challenging for staff, especially for the very many staff who give of their very best every day. The review team are here to help to improve safety, culture, leadership and governance. We absolutely recognise that nationally perinatal services are under significant pressures, but there will also be unique information about the Trust which we invite staff to share with the review team. Do the review team have meetings with staff? The review team ask that staff request meetings via the Staff Voices inbox. You will then be invited to meet with members of our clinical team. The review team ensure that staff meetings are like for like. For instance, neonatologists will meet with neonatologists. Directors of midwifery will meet with directors of midwifery, sonographers with sonographers and so on. This is to ensure that staff are able to discuss their experience with clinicians who understand the complexities of that specific role. The Trust will commission psychological support for staff. This will be independent from any support that you are currently receiving, and you will not need to be referred to this support via the Trust. Staff will either be able to self-refer or ask the review team to make a referral on their behalf. Your involvement with the review is not shared with the Trust at any point. This is to assure staff that they can share their experiences without any concerns regarding confidentiality. The review team are here to help and to listen to your experience of working at the Trust. Speaking to the review team is completely confidential. The only time that we have a duty to share information with the Trust is if you tell us something that presents an immediate risk to safety. If you have any questions about the review or would like to be involved, please contact the office.